Hello, Rocky Mountain Rett Association. This is Tim Benke, your medical director for your Rett Clinic, coming to you from a tent in my backyard. I'm coming to you from a tent in my backyard because I want to talk to you about social isolation and COVID-19. Yes, you could go to this length. This is where I spent the night last night, in my backyard, in my tent, because that's what COVID-19 does to you. It puts you in a tent sometimes. But really, the concern is social isolation with COVID-19. As you know, I don't want any of our patients to get COVID-19 because I think it would be disastrous. As a result, we've made some changes at the hospital and also in how we're approaching things in terms of clinical trials. As you know, Children's Hospital, we've been restricting our outpatient visits because of COVID-19. We think that this may change soon, as hopefully the curve flattens a little bit, but I still think that there's big concerns about any of our patients going out into the community until some strict measures are put in place. And this may include things like universal testing and also having a vaccine. The reason is safety. I am very concerned about safety, and I'm not willing to take any risks with anybody for anything. So I think every family is going to have to come to terms with this in terms of what sort of risks they're willing to take in terms of social isolating until we get to a better place with COVID-19. As you know, we're no longer enrolling patients in clinical trials, and those patients that have been in clinical trials, they've had to stop their involvement because we haven't been able to get the studies that we need to do for those participants to safely participate in those clinical trials. For the Rett Clinic, for the near future, we're probably going to be doing telehealth visits for Rett Clinic, which probably means in the short term, we're just going to be doing follow-ups. We're going to try to figure out how to do new patients in the future, but there's something about a new patient visit that's the only way you can learn from folks. And so we're going to try to figure that out as we go forward. That means for the Rett Clinic that it's going to be a different experience when we do things from telehealth. But we want to work with you to make sure that that experience is still very helpful and useful for you and your family. Once things do get back to normal, I think we're going to be behind in terms of our clinics, but we're going to do our best to make up. I hope that this answers some of your questions about COVID-19. I think we've put some other guidance on the website, both on the Rocky Mountain Rett Association website, but there's also some guidance on the rettsyndrome.org website. If you have any questions, please get in touch. And please, be safe, be healthy out there. Coming to you from my tent in my backyard. Take care.